Hi everyone, I'm Jennifer Jackson. I'm a registered nurse and I'm just finishing my PhD at King's College London. This is a video about writing for nurses, midwives, and for other disciplines in higher education. And what I want to do today is take you through some of the basic strategies I have for writing and for supporting students who are doing assignments. So I had a role as a study skills leader at the library where I would meet with students to work through writing and support them with academic skills. And I found there were several trends that came up in terms of the types of questions and the types of issues students were experiencing. So this presentation was initially designed as a workshop, but in order to make it more accessible, we're sharing it here as a video. And so I'll go through some of my key strategies and things that can help students to feel more confident and comfortable with writing, but also to help you get better grades, hopefully. So I'm going to share some slides here and we will work through them. Okay, so I focus specifically on writing in nursing and midwifery because that was my faculty and my background, but this can apply to other health sciences or writing more generally. So what I'm going to talk about today, and acknowledging that this is initially designed as a workshop, this video is to help make the content more available, but there are some elements that we'll have to adapt as we go through, so thank you for doing that in advance. What I'm going to go through today is looking at what are the tutors or what are the people who are grading your assignments, what are they looking for in your work, so that we have a clear set of expectations and understanding before we even get to the page. Then we'll look at making a plan, how do you outline and write an assignment, and then tips for the actual writing process and the steps up to submission and how you can strengthen that and hopefully do really well with your work. So what are the tutors expecting? Now there can be variability in what people want from you. So it is important to consider that there will be differences on like a case-by-case basis, but there are general principles that connect concepts. So students are expected to attend classes, listen to materials, be engaged with the learning, and read outside of the course and engage with material beyond the lectures. So I think especially in health disciplines, it's important to say this is not just about passing an assignment or checking off some articles I had to read. This is about building my capacity to have a 20, 30, 40 year career supporting people in key life moments. And what is that going to look like? And so if you take that kind of approach rather than an approach to say, oh, I don't want to do this, or oh, I have other things I'd rather do with my time than go to class, I think you will come out much further ahead. So there's lots of resources. At King's specifically, there is a study skills program, there's a library, there's lots of things within the faculty. Everybody at a university, in my experience, wants you to succeed. They want to see you do well, and they want to help you do well. So take the time to find the resources or ask for help, and people are happy to give it. Because if you're putting the work in, we put the work in. But if you're asking us to do the work for you, that's not going to be well received. Now, it's a very minority of students who ever have that mindset. But just to say, if that's the kind of approach you have, that you need to be presented with everything, it's not going to go well. Going to university is like having a gym membership. You put the work in, you get the results. Just because you pay for the gym membership or you pay the tuition doesn't mean you're automatically going to have, your version of a beach body. So keep that in mind. So what I asked tutors in our faculty, but also at universities, like what do they want? So these are their words and their expectations. So they want you to understand that to demonstrate that you understand the concepts and that you can relate those concepts to actual clinical scenarios. So that if we're talking about something abstract like the social determinants of health, that you can say, I worked with a patient who was experiencing discrimination, and that was why she was having barriers to accessing care. So that's where you take a concept and then bring it to an individual case and point out how that concept works when it's shown for a person. Because what we want to do is recognize that we talk about broad theories and broad ideas at university, and then you have to translate, apply, adapt those when you see individual people. And you also need to flag up like, oh, this is what might be going on here. So one of the key things is that you actually understand the concepts and you know how they can be applied. You need to protect patient confidentiality, and you want to relate in your writing to very general examples. Don't tell us too much about the specific patient, because you want to demonstrate that you have skills that apply beyond one individual person. All of your modules, all the courses you do are connected and they build upon each other. So you need to demonstrate that you understand that and that you can see the bigger picture. So when you're learning about mental health, it's not only about mental health. The idea of managing anxiety is one of the most important skills in the emergency department. It's also an incredibly important skill in labor and delivery. So it's not about seeing things in silos, it's what is the whole picture of supporting human health. You also need to spend time with the rubrics and the marking guides. Tutors spend a lot of time producing these guidelines to try and help you understand what they are looking for. And so please take time to look through them, and then if you have questions, you can ask. And the more targeted your questions, the better able someone will be to support you. So please take advantage of those materials, because then it will be clearer about what is expected. So one of the key things tutors want is for you to demonstrate critical thinking. So critical thinking helps us translate our teaching and what we've learned and adapt that, translate that to providing care for a patient. So with the example that we have here, I'll just give you a second to look at that. This is the type of thing that tutors are expecting with critical thinking. One challenge students can have, especially in the early years of the program, is writing in very definitive types of ways, almost as if the person would have orders about what they need to do. So, for example, what we don't want to see is if someone now needs dialysis 3 times a week, will they have to quit their job? That's not a fair ask of someone, especially if they are going through the process of starting dialysis. No doubt there's already a lot of strain on the family, and saying, okay, you just can't work anymore. That's not going to work. So what this could look like is saying we're going to work with the patient perhaps to schedule the dialysis after work, or maybe they work part-time and we build the dialysis schedule around that. Or if we have someone who has to travel, how can we make that as accessible as possible? How can we get education in a language that someone can understand and make it available to their family as well, so that everybody's on the same page? These are the kinds of things that are expected with critical thinking. So we take the concept and say, what does this look like when it is applied, and how is it adapted and translated to make it work for and with patients and with service users? Because long gone are the days, hopefully, mostly, long gone are the days where we just tell people what to do and that's the end of it, because we know that that doesn't work. So what we want to do as nurses and as midwives is build people's capacity and meet them where they're at, and design solutions that might not be medically the most perfect, but are things they can sustain and can work within their lives. So this Sensitivity and this higher level of analysis is what you need to demonstrate in your assignments as well. This is a very similar example of using theory and practice. So you want to be able to connect concepts by name with specific examples. So as you see here, we have pain theory. Pain is what the patient says it is. Well, what if the patient is nonverbal? What if the patient doesn't say what it is? Then how are we going to assess pain? So this isn't throwing out the rules for someone. This is saying, how do we make a general understanding, like pain is what the patient says it is, how do we make that work for someone's unique situation and their individual needs? And that process of problem solving and being creative, that is what makes good healthcare professionals, when you can do that well. And so that is what we want you to explore during your assignments. So I'm very proud of my 1998 PowerPoint graphic animation here. This is one of the most important things I think students can use is Bloom's taxonomy. So Bloom's taxonomy is a way of understanding how different levels of skills are expressed through language. And it's much more complicated than that. It's much beyond what I understand when you look at the whole picture. But what I'm going to talk about is a little Boolean cube or a little drop in the bucket of Bloom's taxonomy and how that will be useful for students. So one of the biggest issues I find is that students describe or they explain at a very introductory level and they don't write at the appropriate level. And so what I mean by that is that if we look at these different words moving across from like 1, 2, 3, 4, as we move along through the numbers, what that is representing is something that's harder. So 2 is harder than 1, 3 is harder than 2, and so forth. Now, I don't mean that 1 isn't hard. And what I am trying to reflect is that when Bloom created this taxonomy, we're saying that these are higher order skills. So defining something is something you can do, but knowing how to contrast definitions is much harder. So one of the biggest places that you will lose marks or have poor grades than you would like is when, say, you have been asked a number 3 or number 4 question and you write at a number 1 or number 2 level. So in thinking, how do I know which level I need to write at? And these numbers don't directly correspond with the level 4, level 5, level 6 writing that's used at King's, just to be very clear. But what you can do is look at the assignment. So it might say, discuss ways in which pain can be assessed for diverse populations. Explore how pain management differs between inpatient and outpatient settings. Use examples in your answer, something like that. What you want to do is take those questions where it says discuss, Google Bloom's taxonomy, look under images, a million things come up. Find one that you like and look for the word discuss, or look for the word create, or look for the word explain. Find the words on that list and then say, okay, so if we have to illustrate how pain may be expressed in people who are nonverbal. Well, if we look along the list, illustrate is number 4, so we are expected to analyze. So that means the bulk of this assignment needs to be on analysis. And so if we spend the bulk of our time defining what pain measurement is and summarizing how pain is measured, we're not going to be as successful in that assignment because that's not what we are being asked to do. So that doesn't, you will have to provide definitions in your assignment. So it doesn't mean you have no knowledge or no understanding demonstrating those competencies. Is that that's not where the emphasis is. So if you write 3 paragraphs explaining what pain assessment is, but you've been asked to analyze how it is translated or to illustrate how it is applied, then you haven't met the criteria for the assessment. And this can be a difference of like 10 percentage points or at least a letter grade level difference. This is a massive, massive thing to get right. So spending some time with the question and making sure you really know what it is that they want you to do and make sure you are in that level. And so if you need to write an analysis or a number 4 type of assignment, look for some examples of Bloom's taxonomy. What are number 4 level words? So you can say, this connects with this other concept, or the theory relates to this person's situation because. You can categorize things. You can go back and forth. If you use the words from that section, the same section that is in the question, then you know you are writing at the right level. So I encourage you to, I'm sure there's lots of other Bloom's taxonomy resources out there. Spend some time with this because it is literally 10 percentage points difference in grade if you get this right, for sure, let alone any other strengthening you can do with your writing. So those are some general principles about what they're looking for and how we identify what point intellectually or what type of knowledge we want to express in our writing. So now moving to our next idea, we're going to look at how do you start an assignment. If you have an assignment, how do you make a plan? How do you approach that? And I know, let's be honest, sometimes the answer is you sit your butt in the chair, maybe put on a Tegaderm beforehand, line up 6 or 7 energy drinks and pound it out and for 6 hours straight, and then fall into bed with some kind of electrolyte imbalance. So that's obviously not our optimal working strategy. Sometimes that happens. But if we have a plan and we can approach this, things will go well, or things should at least go better. So if you think about a clinical day, you would never just run into the middle of the ward and be like, let's just see what happens. That I'm laughing because I'm like, that is disaster. What you want to do is you start with a plan. You say, okay, first thing I'm going to do is everyone's observations or everyone's vital signs. Also assess whether anyone has pain or if there's any like acute change in status. Then I'm going to think about what each person needs for the day and how we can schedule those things. Then move to medications. And from there on, I'm going to go to personal care. Now, something might happen that someone spills their breakfast all over themselves and you need to do personal care sooner than you thought. But you still have a general plan and then you adapt that plan as you go. Writing is very much the same. You want to have a general plan because if you just wade into a blank Word document, anything can happen and it probably won't be as good as it could be if you had a more structured approach. So that's what we're going to talk about here. So when we start with a question, you want to narrow it down and make it something you care about. The questions that tutors give you are specifically very vague. That is for a reason. They want you to be able to take that question and make it into something that you care about and that you like. So they allow you to customize what you want to write about so that it's an assignment that you will benefit from. So for example, in my final year, I was really interested in working in cardiology. That's not where my path ended up, but at the time, that was what I was really interested in. So my final term, I wrote every single thing I had on cardiology. So for pediatrics, I wrote about congenital heart disease among children and implications of that for families. In my sociology course, I wrote about racism and cardiovascular disease. I wrote about women and cardiovascular disease and discrimination. I wrote about access and barriers to receiving cholesterol management in the community. You get the idea. Anyway, they were all different. They were all bespoke assignments for the course I was in, but they all somehow related to cardiology. And because of that, then when I went to my job interview and they said, what do you know about cardiology? I said, well, I was really excited by this recent paper by, Jackson in 2019 about this, 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 this. You blow people away with your knowledge. So if you have a particular area of interest and passion, make your assignments about that. And it will also mean that you can build a knowledge base around a key topic. And there may be a few key references, say like the national guidelines for dementia, caring for people with dementia. You can maybe use those in multiple assignments, so it will save you some work looking up, definitions of dementia every time you write something. That's not to say you can use chunks across different things, but for some key references, then you can apply those, and that will save you a little bit of work. So start out with a couple of issues and narrow down. You want to make your question as specific and manageable as possible. So if we return to the idea of pain, when we think, you might want to start with a blank piece of paper and say, what do I know about pain? And you could list off, pain is what the patient says it is. Pain is difficult to assess in some populations more so than others. Pain can be expressed in a lot of different ways. There's chronic pain, there's acute pain, there's pain after surgery is treated different than oncological pain. There's different ways of assessing it. There's tons of things, lots about pain. So list that all out. Then sit down and say, what I'm really interested in is working with children, and so I'm going to make this about pediatric pain. That's a great start. It's not specific enough. So we say, I'm going to make this about pediatric pain, and I'm going to focus on assessment of pain. We're doing well. We can still make this more specific. So then we can say, okay, I'm going to use, children who are very young, so say under 6 years of age. We're going to look at pain assessment. And yeah, I'll say children under 6, but more than 2. So like toddlers, people who are able to verbalize a bit. And I'm going to look at pain assessment strategies in that population for in-hospital pain management. Or maybe I'll contrast in-hospital with community. Or maybe what I'll do is contrast different types of pain assessment. So pros and cons of the 1 to 10 scale, pros and cons of the FACES scale, other techniques, using emojis, whatever the case may be. So you've gone from write an assignment about pain, which assignment probably wouldn't be that blunt, but let's say write something about pain, down to I'm going to write about preschoolers who are verbal, who are experiencing pain, and how that is assessed as an inpatient using these 3 different tools. Completely different assignment than if you just wade into writing about pain and, children, adults, older adults, all kinds of things. So start with that topic, brainstorm, make a mind map, use whatever technique you like, and then narrow it down to something that is manageable and very, very specific. If you're finding that you're way over your word count and your assignment isn't targeted enough, make your question more specific. So like cut something out and narrow it down more. Maybe instead of talking about all children, you focus on preschoolers, or you focus on adolescents, or you focus on inpatient versus outpatient care. Like if it's too big and you have too much to write about, you need to target more and make it more specific. Okay, so we set ourselves up for success by having a very clear idea of what the question is. And so time spent doing this is time spent working on your assignment. Taking the time at the beginning, taking an hour to sort out exactly what you want to write, will save you 10 hours of muddled writing. I promise you. So sometimes people feel anxious because they want to just put words on the page and start typing, and that's what working on an assignment means. But I challenge you to consider a different view where time spent planning the assignment is also legitimate time spent working on it. So we have a sample question here, and I'll give you a moment just to look at the question and then look at the theory. So if you're not familiar with Patricia Benner's work, in a very brief nutshell, she basically says that the development of knowledge for nurses and midwives, you start as a novice and you move along to an expert. And you have different learning needs at different stages, and you're able to focus your work and focus your understanding in different ways at different stages. So this would be a pretty classic question. How will you develop your practice after qualification, after graduation? Use this theory in your answer. So right off the bat, we want to think about focusing the question. So how will you develop your practice after qualification is a really big issue. So you might say, how are you going to access, part of developing my practice is accessing evidence-based resources, and how am I going to do that? Also, when we have an example of a theory, sometimes students feel like they have to talk about every stage of the theory or explain the entire theory, and that's not necessarily the case. So you do want to demonstrate that you know something about Benner's theory overall, that generally, as we acquire knowledge, we move from novice towards experts, and we have different understandings and different goals and different learning needs at each stage. So that this is something that's going to change over the course of my career, and I understand that. You don't necessarily need to write about every part of the theory. So one thing you could say is that I am going to focus this assignment on the beginner and the competent level, because that's where I will be in probably the first year to 3 years of my work clinically. And so you can say this theory has various stages. They are these things. They reflect these things in brief. But I'm going to focus on the beginner and the competent stages because that's where I will be most immediately. And I'm going to look at how I access evidence-based resources during those stages and what that will look like. Okay, so I hope that's provided some help with how to take a theory and use that in writing, but feel like you don't have to explain the whole thing. You have to demonstrate a broad understanding, but then you can focus on specific pieces, because most big meta theories are big meta theories. And if you have an assignment that's 1,500 words, there's no way you could do this. Patricia Benner's written multiple books. It can't be done, so don't try to. Focus on key points that are useful and build on those and use them to target your writing. So then we have narrowed down our question and we have thought about what we are going to include and where we are going to place the emphasis. We've also made sure that we are writing at the right level and that we are meeting the expectations of the assignment. So now we're going to make an actual plan for the writing. So when we move through, we're going to divide things up with emphasis in different places. So this is a sample outline for an assignment that is 1,500 words, but the same general principles can apply to whether it's 15,000 words, 5,000 words, whatever the case may be. So I suggest that you look at breaking your assignment down and having something like this at the beginning. And then this will help you to orient the writing that you're going to do. So I wrote a book chapter a couple of days ago, and I did this exact thing. I put the headings that I wanted to have, finessed the order, worked on some of the different points I wanted to include, and then essentially filled in each of those sections. And that was so much easier than when I had been trying to come up with something out of the blue, and it wasn't, needless to say, it didn't work at all. So I needed to take my own advice, even though I have lots of years of experience with writing. So when we start off, you want to divide up your word count, and what this can help you do is stay on target. You do not want to write an introduction and find your 700 words in. So the general word guidelines are about making sure your assignment is balanced. And I mean that it's got like a nice flow across the whole assignment. If you have an introduction of 700 words and a conclusion of 20 words, it's not going to be effective. It's not going to share the messages that you want to convey. So this doesn't mean that your introduction has to be exactly 250 words. What it means is that is a general guide, so that if you end up in the 700 word territory, you know that something's not working, and you can stop and say, this isn't working. Do I need to make my, my topic more specific? Do I need to target my resources and my citations more appropriately? Or what is it that I need to change? So here, this is a sample of something you could use. You could have introduction, I've put 250 words here. You can also do a ballpark of about 10%, which would be 150. So you could say 150 to 250 is about where you want the introduction and conclusion. So using the model that I've demonstrated here, with the introduction and conclusion, we've already used 500 words. So you've planned for 500 words without even doing anything further. So the introduction and the conclusion, you're automatically off to a good start. You know you have those in every assignment you write. Allocate the words and you've already got a chunk covered. Then we can look at topic A, topic B, and then a so what section. You can do this different ways. So I've suggested that students, this is kind of a typical 5-paragraph paper or 5-paragraph style. You could also do something like using S-bar. You could say, this is the situation, this is the background, the assessment could be the evidence, and then the recommendations of the so what. So there's lots of different techniques you can use, but what we want to do is organize your writing and make sure we've got like fairly even proportions across the assignment. So here we could say introduction. Topic A is going to be about the beginner stage of Benner's theory. Topic B is going to be about the, was it competent? Oh goodness, we're gonna have to poke backwards and see. Competent, yes. Hopefully I am demonstrating some competence. So maybe topic A is gonna be about being a beginner. Topic B is going to be about being competent. And then the so what section is the most important part of your assignment. This is where you demonstrate the higher level skills like analysis and lots of critical thinking. So this is the section where you might want to say, I know that I'm going to have to grow between A and B, and this is what the theory says, but this is what it might look like for me as a nurse working in critical care, or for me as a nurse developing skills as a home visitor, or as a midwife working in primary care. Then you want to conclude. Your conclusion has no new ideas. It represents the main points and then talks about what the plan is going forward. You've highlighted the plan in the so what section, and then the conclusion can restate that and place emphasis where you want it to be. So you can write out those stages or those headings and then take a few minutes to plan. I recommend if you get an assignment at the beginning of a course or at the beginning of a module, write out those like 5 or 6 key headings, and then as you go through the module, if there's a particular piece of content or particular reference that is going to be really important, just jot a little note of it. So then when you come towards the end of the term and you're writing your assignment, you already have a sheet that has like working ideas for what you could talk about. When you have the so what paragraph, what things you could have as subheadings, even if you don't include those actual heading words in your final assignment, to help guide your thinking, you could put, what does this mean for clinical work? What does this mean for education? What does this mean for research? What about policy, management, whatever the case may be? So you will have spent a lot of time telling us perhaps about how you're going to access evidence-based resources at the beginner and the competent level. And so in your so what paragraph, you can maybe make recommendations for organizations on how they can help new nurses transition and what that could look like. Okay, so the so what paragraph also talks about how you can address the issue on a broader scale than perhaps your individual case or this specific patient population. It's a chance to say, if I had the money and the influence, what would I do and how could I make a positive difference? And then illustrate those ideas with examples. So we've got a plan, we've got some headlines, time to start writing. So see when the assignment is due, work backwards. So if you say, okay, it's due on the 30th, today is the 2nd, what am I going to do? So 30th, I need 3 days at the end to edit and manage my anxiety and make sure Turnitin is working and that the computers don't crash and everything else. So I'm going to say my personal deadline for this assignment is the 27th. That is the day it has to be done. So between the 2nd and the 27th, how am I going to divide up my time? Okay, today I am going to write the introduction. You break it down into manageable pieces. You might say, I'm going to have 3 days of reading literature and trying to get a general understanding of this area. Then Monday, I'm going to do the cover page and I'm going to write the introduction. Tuesday, I'm going to write topic A. Wednesday, I'm going to write topic B. So then it's not, oh, I have to sit down and write this whole horrible assignment. You can say, today I'm going to sit down and write 200 words. Most of us can manage 200 words. And so that will help you feel like, yes, I'm making good progress. And then when the 200 words is done, you've done what you needed to do today. That was part of your plan. And you can move on to something else and not have guilt about, oh, I need to spend more time on my assignment. So this is a good way to break things into pieces, because one of the best pieces of advice I got from my dissertation supervisor in undergrad was, how do you eat an elephant? One bite at a time. So don't look at the whole elephant. Look at how you can take one bite at a time and break those bite-sized pieces up. Apologies to any vegans. I would never actually eat an elephant, but I'm not able to pull to mind another example. So hopefully that can resonate with you in some way. And so when we're looking at strategies for writing, how can we approach the actual process of sitting there and putting words on the page? This is great to have discussions with your colleagues, see what other people are doing. There's lots of writing blogs, there's lots of time management blogs, there's all kinds of suggestions out there, and people have found different systems that work for them. Some people say they need to write every day. Some people say they need to specifically put an appointment in their calendar with themselves, and that's when they write. Other people say that they like to walk around with a recorder, record what they're going to write, and then transcribe it. There's lots of different styles and techniques, and part of the learning process in academia is figuring out what works for you and what strategies you can implement. So that is just as important as the actual words themselves. I highly suggest you make some kind of plan. It doesn't have to be the specific one we've talked about in this video, but something that has some shape to it that you can make into manageable pieces. Do not wait till the last minute. The other thing that's going to be a challenge is when you have multiple assignments. You want to look at those and say, how am I going to manage this? This assignment is 400 words. I can write that in 3 hours if I have to. This assignment is 10,000 words. That is going to take a month. So what you need to do is look at these different things, prioritize which modules or which courses do we need to do really well in, and what do I really need to get this assignment right, because maybe I didn't do so well on the other assessments. What is it okay if it's not a star performance, but it is credible work? So you can think about how much emphasis you need to place in different areas and then plan your time accordingly. There's lots of also different techniques for editing. So you put it away for a few days, read it again, read it out loud, have your computer read it out loud to you. Seek out some support, whether that's through study skills at King's. Almost every university has some type of study skills capacity. Send it to someone. I have a great aunt who loves to read my writing, and so I send her things all the time. So she enjoys going through them and picks up lots of my mistakes. So whatever works for you, find a technique so that you can have a second look before you submit something. If you're stuck, don't stay stuck. Either say, you know what, enough, I'm going for a walk. I'm going to call a friend. I'm going to have a little break. I'm going to work on something else and come back to it. There are times when if you sort of push through the grumpiness and you get going, then you're fine. But if you're really struggling and you're overtired, sometimes it's time to say enough is enough. I'll come back to this another day. If you're having a hard time, make some nano progress. If you're thinking, oh, I just can't do it, write one sentence. Maybe that's your goal, is if there's an assignment that you've been avoiding because it's a really intimidating thing to do, write one sentence. And then you might find that you write that, have a little chuckle with yourself, and then say, you know what, that's not so bad. And then maybe you can write 3 or 4 more sentences. And that's just a way to get started. So make nano progress. If that's all you can do, put 5 words down, and then your assignment is started. Then you don't have to start. All you have to do is continue to develop. And also avoid the trap of cleaning your desk, playing with your cat, readitis, which is I need to know everything about this before I start writing. Just write. Even if it's full of holes, it's full of mistakes, it's fine. You write it and then you can build through and edit things. Ernest Hemingway, who I believe won a Nobel Prize for Literature, said the first draft of anything is shit. So I figure if Ernest Hemingway can say that, I could possibly use that strategy as well. So don't be hard on yourselves. We don't have to have perfection, especially not at a first draft. Put some words down and build it. This is the foundation and you can build as you go. Turn the Wi-Fi off, turn your phone off, put the distractions aside. Some of my colleagues use the Pomodoro technique. They love it. I find that that doesn't necessarily work for me, but I find other strategies that work for me instead. And Pomodoro is really nice because it reminds us about the importance of taking breaks, even just to stand up, stretch, shake out your wrists, move your back a bit. You know, there's nothing worse than trying to finish an assignment when you're achy and full of pain from being immobile at the computer for a long time. So definitely remember to take breaks and take care of yourself. Nobody does their best writing if they have had granola bars to eat all day long. So if you need to take a break, make yourself some proper food, do that. That is part of writing. It's very difficult to do it otherwise. And also know procrastination happens, but the most important thing is to say, okay, do I need to put my phone away, turn it off, put it in a drawer in another room and leave it there? Or is it time for a 5-minute break? And maybe I can have a 5-minute break and then come back to this. Or maybe it's time for a longer break. Or maybe it's time to just push through and say, stop being distracted. So don't be hard on yourself, but also get that routine of like, hey, I'm doing some procrastinating right now. What's this about and how can I address this? And that will work much better than 8 hours of Netflix and then 3 hours of crying and writing. You'll do much better, I promise. So just to recap, work out what is expected of you. You can use Bloom's taxonomy and you can also use the guidelines from your syllabus or any of the course materials you've been given. If you have any doubt, ask. People are very happy to clarify. It's completely acceptable to say, I'm just not 100% clear on this aspect of the assignment, and make sure you're very clear on what you need to do. Develop a plan. After you narrow down and target the question, make it something that you're interested in and something that is meaningful for you. Over time, writing is like a muscle. You can develop good writing strategies and good writing habits, and they will serve you very well. And after this video, after workshops, I want you to take a moment and think about what one thing have we talked about that would perhaps help you with your writing. What one thing can you try and do? Because if you go back to your desk and you say, okay, right now I'm going to make plans and I'm going to do this and I'm going to do this, I'm going to do this, it's a lot like going to the gym in New Year's. It's not necessarily sustainable. But if you say, you know what, I'm going to walk the first part of my journey and then take transit the rest of the way, that is a type of increasing activity that is probably going to work and be a lot easier to stick with. So maybe what you're going to say is, before I write something, I'm going to make sure I put the headlines on a Word document. So think of something very specific that you are going to do and hold on to that tip and adapt it as you need to help improve your writing. All right, so feel free to, if you found this video on YouTube, you can ask any questions or anything in the comments. And you can also go to Twitter. I'm at jjackson_RN. And I'd be happy to do any follow-up or answer questions if you have them. And I encourage you to try and take these general principles and find something that works for you. And I wish you happy writing and take care of each other.